Sir, we are live now.
Okay. Hello, dear students.
Hello, friends.
Hello, good evening, friends.
Hello, dear students. Very warm welcome to all of you. Good evening, Ankur sir. Good evening, Pooja ma'am.
Good evening, sir.
Yeah.
Good evening, ma'am.
Good evening, sir.
So, first of all, happy Doctors' Day to all our dear doctors, our dear little students, and also, sir, ma'am, to you.
Thank you, sir. Thank you so much.
Thank you, sir.
Happy Doctors' Day to all the budding doctors who wants to serve the humanity. A very happy Doctors' Day. You have chosen this field. I'm sure that you are going to do, justice to it.
Happy Doctor's Day, my dear friends.
So please continue.
Sir, so here we are, sir and ma'am, we are here as we all know that our first prof exam is very close across the India. So at this time, we all the students are getting too much confusion and lots of the stress. So this is the very, very special session. Yes, dear students, this is the very special session for all of you. How to crack the first university exams. Once again, I want to introduce our respected Dr. Ankur Jain sir, the Biochemistry faculty at the Cerebellum Academy, and Dr. Pooja Nigade ma'am, the Physiology faculty at Cerebellum Academy, and myself, Dr. Shrikant Verma, anatomy faculty at the Cerebellum Academy. So this session is a beautiful session for all of you, amazing session for all of you, dedicated for the first prof students to crack the theory exam as well as practical exams. Yes, Ankur sir, please address the students for such kind of the amazing parts. What is the importance of this session?
Actually, we are planning that for 1 month or up to your exam, we should come daily for 1.5 hours so that we can refresh your topics which are commonly asked in your university exam. At the same time, with the topic, we will also tell you the Viva questions and the practical aspects of that particular topic. So this is a introduction in which we will tell you that how we can crack exam of university with little efforts, and whatever hard work we have done, how we can systematically use that information to get better marks in your exam. Sir.
Very nice, sir. Very nice. So we are going to start this session without delay. So let's start this session. First part, I will tell you all the dear students with the help of the Ankur sir and the Pooja ma'am, how to crack the theory paper. 9 golden points for the theory. And then respected Pooja ma'am will tell you what the points we have to remember for our practical exams. And then especially very special session by our respected Dr. Ankur sir. He will tell you how to reduce the stress and how to maintain our psychology during the exam so that we can feel relaxed, because the first MBBS exam, it is too much stressful. Okay, so let's start this session. So the 9 golden points for the theory, and dear students, any kind of the thing, first prof students, you can comment at the chat box and please inform your all the dear friends. It is very useful session for the first prof. Don't miss this session. So during the theory exam, we have to read the instructions carefully. First we will discuss about it, then we will learn how to write the answer. We have to create the proper headings to get more and more marks, and then we have to leave the margin. We will talk about the margin in the answer sheet. We have to leave blank the margin so that teacher can give the proper marks and he can introduce that marks in the first front page. Then we have to learn how to make the proper gap between the two answers, because if we are mixing the question, the teacher will not be able to give the proper marks for that two question. So we have to leave that gap. We have to write clean. Definitely today is the doctor's day, and yes, we all the doctors are having the bad handwriting, not good handwriting, and especially during the exam our handwriting is become very bad. So at least we have to make the gap between the two words so that the clean letters can be seen. Then we will see the use of the proper color and underlining the main point. It will give the your points. Then we have to write the relevant answer, extract we have to see. Then we will see, we will talk about the time management during the answer writing, and don't leave the blank any question. These are the points. So can we start, dear students? Yes, yes. This is the session. Yes, Anjali, this is the session for the Medico MRG University from the Chennai. So Ashok is from the MRG University Chennai. Please inform to your all the friends, first MBBS students. Okay. So Ankur sir, Pooja ma'am, we are going to start the first point. Read the instruction. So definitely every question paper, either the anatomy or the physiology or the biochemistry. Yes, you will see the first instruction attempt all the questions in the sequence. So dear students, when you are attempting the question in the sequence, then teachers, when they give the mark, this is your answer sheet. So on the front page, one side you are writing the name, roll number, university, your prof, this all. But here this part, generally all the state, they are having the marking system proper, and there are the boxes. So if you're not attempting the question, this is the practical experience we are dealing with the students, we are giving the marks. So what happens if the students are not solving the question number 1, 2, 3, 4? So what happens? Sometimes the marking is disturbed by the teacher. Why? Because teachers are coming, they are marking the answer, they are answering, they are just checking the answer sheet in the 3 days or 4 days, and there are the 150, 200 students. It is very difficult to give the proper number and to check all the answers. So it is very difficult task. So if unfortunately you are just writing 1, then 3, then 5, and yes, 3 is having your, yes, A, B, C, D, E. If you're not doing in the sequence, and suppose you are writing the E answer after the 5th, and unfortunately, if the teacher is missing that one, so he will not be able to enter on the front side. So you are attempting the question, but it may be lethal. Your mass, you are attempting the question, but you are not able to count that mass in your answer sheet. But what happens sometimes, sir, Ankur sir, please add the next point. You are better for this.
Before reading the next point, I will like to address one thing that try to attempt a question in a sequence. But if you know that this question is very well known to me and it's where I have put so much of effort to learn this, and I know recent advancement about this question, so try to attempt that question first, and so that the first impression is last impression. I have seen that when examiner start checking paper. At that time, the first impression will tell him that how the next questions are being done by this student. So it's my personal advice that if you know one question very nicely, recent updates, all the important points, then try to attempt that first, leaving the first rule. Few exceptions are there, in medicine you will find everything is with the exception. So this is very important exception. First impression is last impression. Do attempt that question which is very well known to you and in which you have little bit extra information, recent advancement. Ji, sir.
Right. Pooja ma'am, please share your experience.
Yes, sir. The thing is that you have to write something in the exam. You should not leave anything, right? Because what happens is, as sir said, that is important that you write the, sequentially or whatever comes in your mind. Or let's say my question 3, option C, or question 3, subsection C is nicely known. But the thing is, question 3rd is checked by some other faculty. Question 4th is checked by some other faculty. That happens in Delhi University. I am from Delhi University, so I know that, right? So even if you attempt the 3rd question nicely, but you haven't tried anything in the 4th question, definitely the examiner who is going to check the 4th question, he will not give you any marks. So first thing first, don't do injustice with any one question. Yes, definitely whatever you know, as sir said, Ankur said that you have to portray whatever you know very nicely. But yes, you should not leave any of the question, and you have to attempt all the question at least on the average level, so that even if the question is checked by other faculty, they should be able to give you the marks.
Right, ma'am, nicely said. And the next point, draw the well-labeled diagram. So as you all know, anatomy is the dissection is the anatomy. But in answer paper, we cannot present the dissection. So dissection is represented by the diagram. So you can say anatomy is diagram and diagram is the anatomy. And also you will find the same thing in the physiology. If you are proper making the diagram with the proper labeling, proper color coding, then definitely you are getting the extra charm. Because when we examiner are checking the copy, colorful image is there, directly our attention is towards the diagram, and we can decide with the image that students is aware about the answer or not. And we are not reading all the lines because time is very concise for the external or internal. And yes, Pooja ma'am, what you want to say about the physiology?
Yes, about the physiology, you don't have to, even if you don't know, a very beautiful diagram, you're not an artist like Shrikant sir, so don't worry about it. Even if you can draw the charts in physiology, we'll be more than happy. You have to
Yes.
write how this is happening, why this is happening. Just draw a basic line diagrams and show, label it nicely, as sir said, right? Add some flow charts. That will be even sufficient in physiology. I think that is same for the biochemistry also in the cycle. Ankur sir, what do you say in that?
Yes, in cycle, just sir said, ma'am said, draw that cycle and highlight rate limiting enzyme and any clinical significance. If suppose I talk about glycolysis, pyruvate kinase deficiency lead to hemolysis, so point out at the same time, at the same place. So it will help examiner to understand that the student is knowing the clinical implementation also. So that one chart or one pathway or one diagram will tell examiner that the student is having very good knowledge, and definitely he will not read the old stuff, and it would be convenient for him and you also. And anything which is convenient for me, definitely that I will give maximum marks to that person.
True, sir, true. That means you have to think from the perspective of the examiner that if you are the examiner, when you will give more marks to that particular students. So understand, you have to think in the perspective of examiner that I should write in such a format that examiner should get, yes, these points students have written. So I'll not go in the detail. Even if you have missed 1 or 2 points, I'll just let it go and I'll give the marks. Yes, sir. Absolutely wonderful.
Yes,
Shrikant, sir.
very, very rightly said. So this is the our extract. In anatomy, you have to draw the diagram. Physiology, along with the diagram, flowchart is very important. And in biochemistry, cycles. And remember, whenever you are writing the answer, try to mention the clinical in each and every subject. It is
Right, sir.
adding the extra mark. Okay.
Clinical significance or applied aspect. True, sir.
Yeah,
True.
every subject. So the next point, we are coming to the our next point. Yes, heading. So try to understand, dear students, this point. This is your answer sheet. Okay. And what you have to do, whenever you are writing the answer, leave the proper margin and give the proper heading. Suppose, just I'm giving one example. In exam, suppose the question is asked about the joint, any joint, either the shoulder joint or the hip joint. You are not too much aware because at the time of the exam, we are forgetting the everything. But remember this guideline, it will give the maximum marks within the certain limit. What? Sir, you have to give the introduction about the joint. Yes, it is the joint of the pectoral region, our shoulder girdle area. And then give the points. Never write the essay, either the physiology or the biochemistry or the anatomy or any subject. Always give the point-wise description. Next, you will describe about the type of the joint. Next, you will describe, yes, you have to give the heading. If you are giving the heading in the margin, definitely you are going to crack the more and more marks. Then you have to do the well-labeled diagram. Draw the beautiful diagram, colorful diagram, proper labeling, proper arrow. Yes, it will give the maximum marks. And then you have to write down about the relation, anterior, posterior, medial, lateral, this all. Then you have to mention the movement of the joint. And the next point, you will include the nerve supply. You will include the arterial supply. Yes. And other point you can add like the clinical. Okay. So when you are writing any answer, any subject, and you are showing this heading, yes, you will get the more and more marks. Okay. Yes. Pooja man, any point extra you want to add?
Yes, sir, you have added that already. And even if you cannot do that properly, for that, what should be ready is your mind map should be ready. I always tell you, this is not the time to go and read all the books passively. Now it's the time to do the smart study, right? And there our role comes, right? We are going to tell you that you are going to get the maximum marks, write this, do that, right? So we are going to make the plate ready for you, right? You just have to eat that plate. We are going to make that snack ready for you, right? So you have to add these points, you have to write this clinical aspect, right? So there our role is going to come. And the main thing is, as sir said, if you have to write all these things, for that your mind map should be ready. So I always tell my students to go retrograde right now. Do the smart study. Retrograde means check the PYQs, check 5 years at least, last 5 year questions. And if this question comes, what I'm going to write, that mind map should be ready. So during the exam, you should not waste your time thinking, right? You should be ready that, okay, this question come, I'm going to write this, then this, then this, then this, right? So that is known as the mind map. And that is going to happen whenever you're going to have the, things ready in your hand. So that is going to save our time. I think that is my point. Ankur
Right.
sir, what you want to add?
Yes, in biochemistry, any pathway if asked, as Sir Ma'am told, that you should describe in headings. So keep all headings in your mind. Important points in which any pathway or cycle can be described. Just like first thing is alternative name. Just like if I talk about Krebs cycle, TCA cycle, okay? So you must citric acid cycle, 3 names are there. So you will point out. Then site, it is occurring in which organ. Then which compartment of cell it is occurring, what is the rate limiting enzyme, what is the regulatory enzyme. Rate limiting and regulatory are different concepts we will discuss during our sessions, as we have planned session for 1 month up to your exam. So in those sessions we will try whatever we are talking, we will try to implement in our session so that it will be more fruitful. Okay. So, because, in theory, we sometimes say so many things, but you can't imbibe all these things. But when we will show you in our class, then it would be definitely useful for you. So it would be 1 hour a day, different subjects will be covered. So remain connected and try to imbibe all the information. That means these should be in your habit. So within 1 month, you will be imbibed with those things. But yes, you have read a lot. Now you have to structure that content, and in that we are going to help you. Okay, so I told you recent advancement, you will add clinical aspects, you will add, just like I tell you one example, just like in Krebs cycle, if you are writing Krebs cycle, you must tell that there is a mutation in isocitrate dehydrogenase that can lead to AML. Okay, that can lead to cholangiocarcinoma, and what's the treatment. So all these aspects, if you write in the question, definitely you will get extra marks. And with that, these points we are coming.
Very
Sir,
nice,
yeah, sir.
very nice, sir. Very nice. So, dear students, now come to the next margin. As I told you, whenever you are writing the answer, try to leave the margin right and left. Yes, here you are giving the adding, and yes, the teachers, they can give the marks here 5, 6, 7. So it is highlighted. So at the end, when the teacher will do totaling, no question will be left. So remember this margin point also. Okay. So now come to our next point, proper gap between the two answer. So whenever you are writing the answer to A, suppose, then you are giving the point wise answer with the heading and whatever we told. And then you are starting the next. So remember, you have to highlight that you are starting the another one. Otherwise, what happens? In hurry, there is a mixing of the question and the teacher cannot differentiate. So remember this point. Okay. Yes.
So
Now,
one more thing, as you told, that student can leave extra 2 to 3 lines, so that even if later on when you got extra time and you want to write something, it will not be gich khichdi like a concept, right? It will be a clear concept. Leave 3 to 4 lines extras, and you don't have to, as many as papers you want, you will get those papers. So don't worry about the papers. Leave 3 to 4 lines extra, as sir said.
yes, right, ma'am. Sir, any point you want to add?
Continue, sir, continue.
Yeah. So there is the proper gap between the answer. And after that, so doctors' handwritings are very bad, but you can try whatever the answer you are writing. Suppose you are writing about the joint classification. So our handwriting, it becomes very bad during the exam. So what we have to do, we can leave the space in between the two letters, in between the two words. Okay. So whenever you are leaving the words, the space will be proper. So it will be the clean representation. Are you getting the point? Means we are too much in hurry. So we cannot make the proper handwriting, but we can present clean handwriting. So be careful for it, and definitely proper color and underline main points. Yes. Ankur sir, please tell the students something about it.
Sir, color means it is just to highlight the things which you feel you are that is important, and which will definitely impact the psychology of examiner also, that he has sufficient time to point out, and he is well organized or she is well organized to tell what is to see, what is not to see. So if you will do proper color, in fact it is more important in anatomy, because artery has having red color, vein is having blue color. So color coding is definitely important for anatomy. But in biochemistry, if I say that different colors can be mixed, but keep in mind that one thing should be done with one color, and the second thing should be done with, just like if you are writing the substrate and the product, you take one color, and if you are writing the enzyme, you can take different color. So it will differentiate, and it would be it will look nice also. And whatever we feel that is nice, definitely we will give extra marks.
Right, sir, right. So now come to the next point. Write relevant answers. You have to write extract. So Pooja ma'am, any point you want to add here?
Yes, sir. We are not there to, read Ramayana and Mahabharata, whatever you all know.
Right.
It's just that we want to give you marks. The examiners are there. They want that this is asked, whether the student know the concept or not. We just want to know that. So write accordingly, right? If it is for 2 marks, don't write 2, 3, 4 pages, right? Just write 1.5 page. That is sufficient. Yes. But it is for 10 marks, write at least 3 to 4 pages. That is necessary. In detail, you have to write. Go according to marks. That is my advice. Yes, sir.
Perfectly, ma'am. Perfectly. So, dear students, now moving for our next point, time management during answer writing. So, what happens when there is our question number first, and we are writing too much? Yes, we are taking the 1 hour for the one long question. Okay, and then the remaining questions, just 2 hours. What happens? Yes, we are spending to attempt the other question in the next 1 hour, and at the last, too many questions are left. So, there is too much hurry. So time management is very important. Yes, do proper distribution of the time so that you cannot leave any question. If you're leaving any question, it is suicidal. It is very little. Don't leave any question. So time management during answer writing is very important. Next one, don't leave blank any question. The last point of the theory, golden point of the theory. Don't leave any blank question. Yes, Ankur sir, please tell the students any point about it.
Yes, many times what happens, we feel that this question is not read by me, but if you will be cool and calm and will think about that question, you will find at least some information you are having at your conscious, unconscious or subconscious mind. So just take a deep breath and think what you have read about that topic, and you will find at least some stuff, relevant stuff. Okay, if you are don't leave means you will not fill by love story. At least you should write some relevant thing, and trust me, whatever hard work you have done till now, that is sufficient to find 1 page at least for any question. Okay, so trust yourself and try to recall that information, and definitely you will find relevant information about that question. So don't leave, because if you are leaving anything, the examiner has no choice to give you any marks, So better to write little bit about the topic or question.
Perfectly said, sir. So now we are moving for our different types of the question. You all are aware, long answer question or long note 10 to 15 marks each, short answering question, short note 5 marks. Only draw the well label diagram. Don't write anything in such kind of question. 5 marks each, and enumerate. So only you have to enumerate, like the branches of the external carotid artery. Yes, only you have to enumerate. You don't describe this. 2 marks each, and MCQs, it varies state to state. Sometimes 10 questions, sometimes 20 questions. Okay, so now we are coming for the golden points about the practical, especially prepared by the Pooja ma'am for you all the dear students. Yes, ma'am, please start.
Thank you, sir. So we are going to crisp and very concise to it, very to the point. You can read all the points, right? First of all, whenever you go to the practical, just have that professional appearance that you are going to be a doctor, right? So your dress code should be proper. You cannot just come in the pajamas and the slippers, right? You have to wear a proper clothes, right? And proper hairstyle should be there. Well, if you're going to the hemat lab, especially in the physiology, the females, especially the girls, their hair should be tied properly, right? Then the polished communication, when you are talking or giving the answer to the examiner, be a calm person, right? Don't be in the rush. Ma'am, aise ho, uska ye hoga, uska ye. Don't do that, right? Just stay calm, right? Think what the examiner has asked and give the answer. Then, if you don't know anything, if you feel that this question is alien to me, I don't know anything about it, I never heard about this method or this mechanism, just politely say, ma'am, I don't know right now, but I will definitely read about it, right? So give that positive vibe. Don't just, give any answer. Then the comprehensive response, that means whatever is asked, keep that this much only, right? If you know it very well, just ask that, ma'am, can I explain it in detail? If the examiner says yes, go on, then only go on. Just don't, go in the manner or go in the line where you don't know the, you can say that is the dark area for you. Otherwise, you are leading the examiner in the dark area. So next point, please. Then you know that you have to show that you are confident, you know the answer, be confident, right? Then good posture. You just don't slouch or don't look here and there and you don't know what is happening. Don't do that, right? Stay confident, maintain a good posture. Your body language will tell many of the things. If you are, showing the microscope, so use your hands and use your active smartness over there. Be honest, give the honest answer. If you know, right? If you don't know anything about it, just admit it. Listen carefully. If I'm asking how that is happening, don't tell me what is happening and what will happen, right? I have asked the question, how that is happening. You have to tell me how that has happened. What is the mechanism behind it? So listen the examiner, what he is asking you, right? Stay calm. Don't be under pressure, because whenever you are anxious, your sympathetic system is going to rush the adrenaline system, right? There will be adrenaline rush and you won't be able to answer properly. More will be talked by Ankur sir. Clarify the doubts. If you didn't understand the question, really didn't understand what exactly the question was, then ask it politely, ma'am, can you please repeat it? Definitely the examiner will repeat it rather than, giving the wrong answer. Practice makes everyone perfect. So there is no shortcut for this. Practice, as I told you, see the PYQ, and that's why we are there. We are going to help you out. Our WhatsApp group is there. If you are not understanding a particular topic or particular question you want us to answer, definitely you can contact us. 24/7 WhatsApp group is there, and every day 1 hour we are going to be there live with you guys. That's also from my side.
Very nice, ma'am. And dear students, now to understand the psychology and the biochemistry part especially, I want to invite Dr. Ankur sir. Please, sir.
Thank you, sir. I will not take much time because we are going to meet so frequently. So no need to take tension. All the things we have told you, we will involve in our discussion of our sessions, which will be conducted daily on our channel. The timing would be around, different timing that would be given by notification.
5:30 or 6 in the evening, sir.
5:30 or 6 in the evening. Okay, that will be notification would be there to remain connected with us. Just to tell you that how we are going to proceed in our subject, just like as I told you that you should have clear-cut information about a particular topic, a particular pathway, particular cycle. Yes, whenever a question is asked, you must write the alternative way, alternative name over that pathway. Just like I told you example, if I take glycolysis, Amnon-Meyer pathway, another name, site, it is occurring in which organs, you must mention. Yes, compartment of cell, it is in cytosol, mitochondria, smooth endoplasmic reticulum, rate limiting enzyme, always you must know. Irreversible steps, you must know. Other than that, yes, regulation of particular pathway. Yes, it is very important. Allosteric regulation and hormone regulation. Do comment even if you don't describe much. If you write in a short and by these points, definitely you will get maximum marks. Clinical consequence of a particular enzyme defect. We will discuss with the topics. I will give you one example also. Okay, recent advancement. Just like recently we found that isocitrate dehydrogenase mutation in Krebs cycle lead to epigenetic modification. This lead to AML, cholangiocarcinoma, and they have a specific treatment for that. Means if a patient of cholangiocarcinoma came to me and I found that this is due to mutation in isocitrate dehydrogenase, we found that in this patient, CD nibs are going to give maximum benefit and that will be prescribed. So if you write these types of questions and answers, means if you give answer in this way, definitely you will get better marks. And I will also give you the memory map of all pathway integration, just like sir has shown this on this. So I will discuss that also. In this pathway, you will find this in green color coding is also there. Yes, not in anatomy, in my green color is also there. Within fad state, all the pathway which are occurring in fad state, I have taken green color, and which are occurring in fasting and starvation, I have taken in red color. And how these pathways are integrated. If you will remember this flow chart, you can solve multiple short questions, long questions very easily. Okay, in this I will point out each and every rate limiting enzyme, irreversible step, how these pathways are controlled by hormone regulation. Just like all red pathway are activated by glucagon, all green pathway are activated by whatever it is shown in my flow chart will be activated by insulin. So in this way you can. And one animation is very important, and mnemonics are very important. Just like I made a mnemonic for fatty acid synthesis. Yes, in fatty acid synthesis complex 6 enzymes are there. Very difficult to remember. When question is asked, you must know. First is MAT. I remember MAT as MAT of Aladdin. It will join acetyl coenzyme A and malonyl coenzyme A. Okay. After MAT, acetyl malonyl now Kasab will come. KAS. KS, ketoacyl synthase, I remember Kasab. He made bomb blast. And when a blast, carbon dioxide. This is called condensation reaction. Carbon dioxide is released. Now next enzyme is CAR. CAR, not CAR, it is KAR, and it attach hydrogen, ketoacyl reductase. Now, water is removed. Yes, you can see nicely that these vipers are removing water, dehydratase. Then engine oil is reduced, enoyl reductase. So CAR, dehydratase, enoyl reductase. Now, this 4-carbon ketoacyl is converted to 4-carbon fatty acid. Now these cycles will occur again and again. Acetyl will be transferred to cysteine. Pen will be attached with malonyl. Again, CAS will come, Kasab will come, will do bomb blast. And CO2 is removed. And again, CAR will come. So 2 to 4, 4 to 6, 6 to 8, 8 to 6, 8 to 10, 10 to 12. Each cycle, 2 carbon atoms are joined. And in this fatty acid is synthesized. And in the last, yes, just wait. Yes, enoyl reductase, engine oil reduce ho gaya. That is enoyl reductase. And ultimately, after so many cycles, most common fatty acid which is synthesized is palmitic acid. And the last enzyme is thioesterase. Esterase as Ustra. Yes, how we do Ustra? Yes, you must have seen barber do Ustra like this in palmitic acid. So most common fatty acid releases palmitic acid. So we will try to do animation. We will try to make mnemonic. And with the help of animation, mnemonics, and these flow charts, you will be able to understand biochemistry better, retain biochemistry better, and reproduce the concept, information in your exam in a better way. Okay, so remain connected. This is my part. I know Dr. Shrikant, Dr. Pooja ma'am will take care of physio and anatomy very well, I know. Okay, sir, over to you.
So very, very beautiful presentation. So students will definitely like, and it will be very helpful during the exam. So dear students, yes, we are coming live for your important topics, which are surely going to ask in your exam in anatomy, physiology, and the biochemistry. And do comment at the chat box what topic you need. Yes, make your groups, join our WhatsApp group also. Comment there what you need at this crucial time. All the faculty of the Cerebellum Academy are with you. So thank you very much. Yes, Pooja ma'am, please address the students.
So basically the mind map should be ready, and we are ready to do the hard work for you. It's just that you have to tell your problems to us. You have to reach to us. That's the only thing we are asking, right? If you don't tell your problems, we will not be able to solve. So what we want is your response, right? And what are the problems where you are stuck, right? जिसने करी शर्म उसके फूटे करम, है ना? So बेधड़क पूछो, जो भी questions है, just ask without any hesitation. There is a WhatsApp group group. We are available on Instagram. We are available on various platforms like Telegram group, on the YouTube. If you have a particular doubt, just ask us and we will find some solution for sure. That's all, sir.
Okay, dear students, thank you very much. Thank you, sir. Thank you, ma'am.
Thank you, students, for
Thank
listening.
you.
Best wishes for your exam. Continue your hard work you have done for 1 year. Yes, and now don't stop, continue. And in the last, yes, one aspect was left. Sorry to extend the session. Yes, many times thoughts will come that I will not be able to clear this exam because so much of content is there. I can't remember. Yes, this happens to each and every medico. So just believe in yourself that whatever hard work you have done, that is sufficient to clear your first prof exam. So be positive, remain cool and calm. They don't want your knowledge. They want your emotional balance. What I said, emotional balance. Yeah, nowadays, EQ is given more importance. Why? Because after becoming a doctor, if you are in emergency and adverse situation came, a very serious patient came, and you are having anxiety, you will not be able to perform. So you must be cool in any situation. If Viva is there, if you are not knowing the answer, if you are forgetting, be cool. This is the thing examiner wants, that you should be cool enough to think wisely at the time of adverse situation. And during this preparatory time, yes, I will guide you, not me, sir and ma'am, will also guide you with a very huge experience, how to remain cool and calm, how to improve your emotional quotient. Yes, IQ can't be improved, but EQ can be improved. So we'll try to do that with our experience. We'll try. Okay, definitely. Thank you.
Thank you so much, sir. Thank you. So, dear students, we are ending this session. Hope you all enjoyed. So, join us. We are going to live. We all are coming live to solve your problems. So, ending this session with this positive line. सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं. कोशिश है कि सूरत बदलनी चाहिए. हमारे सीने में नहीं तो तुम्हारे सीने में ही सही. कहीं भी हो आग, लेकिन ये आग जलनी चाहिए. ये आग जलनी चाहिए. ये आग जलनी चाहिए. Thank you, everybody. Good night.
Good.
Good night. All the very best. Bye.